The South African National AIDS Council has started working on the implementation of a new national strategic plan for HIV, TB and STIs for the period 2023-2028. The process will replace the extended plan that was meant to have ended in March of this year but was extended due to the COVID-19 pandemic. Let's talk further about this then with the Council's Dr. Rogerio, Phiri. Doctor, very good afternoon to you. Thank you so much for your time on Daytime Update and your patience. Where in the process are we in terms of working on this new strategic plan?
Thank you very much, Tembegile, and good day to the viewers. Yes, the South African National AIDS Council is now in midway in terms of the development of the new strategic plan for HIV, TB, and STIs. It's normally is a year-long process because it involves consultation with a variety of stakeholders in the country, so that the document that we produce has got a buy-in from all the stakeholders involved in the interventions to end TB and HIV as public health threats by 2030.
You're also quite intentional, you say, about increasing community input in coming up with this plan and the way forward. But to what extent will you be seeking those inputs, and with what objective in mind?
Well, the consultations with the community is a crux of the development of the NSP. SANA consults widely with communities at national level as well as at provincial level. At this stage, we have completed all the consultations with stakeholders at those levels, and these are the people that range from the normal community who are using the services for HIV and TB to the NGOs and other partners involved in the community response. So we believe that the process that we followed was quite comprehensive, and now we have got the inputs from those communities as well as from the expert teams that we had set up to enable an efficient process of development of the NSP, because we need to ensure that the policy will pass scrutiny even of the other international policies of such. So we are 90% there in terms of the consultations. At this stage, we are already producing a draft which should be ready in a week's time for consultation as well as the review by other bodies that work with us, such as the World Health Organization, UNAIDS and other partners.
Why is it that you were only able to meet the first of your, shall we say, 90 target areas by the end of 2020, and where are you with the rest of that process? Because if there's a lag, that then carries on, does it not, into the next period, which is now 2023 to 2028, I think?
Yes, that process was affected by many factors. I think they are usual ones. So, for example, the issues relating to the inaccessibility of some of the services for some populations, especially the key populations who are at the forefront of driving the epidemic, because they do require customized interventions to reach them. But also the effects of COVID were quite drastic. We remember that during the lockdown, for example, people were restricted in terms of accessing services. Even some of the supplies that were required were affected due to lockdown measures. And hence, this is why then we delayed the process of development of the new NSP to allow us to catch up with all of the lost efforts that happened as a result of COVID. So I would say that COVID was the major contributor in terms of those delays, in terms of those 90 targets, which now we are trying to scale up to 95 in line with the UNAIDS recommendations.
Two things. Time has moved on since South Africa's first experience, and the world really's first experience of responding to HIV and AIDS, STIs, as well as tuberculosis as well. There's now been a lot of lessons learned from the COVID-19 period. Do we need a complete overhaul of our strategic thinking?
Yes, there is a need, because I think, as you are pointing out, the COVID taught us quite a lot of new lessons. There are some innovative ways of doing things. So, for example, to ensure increased access to services using electronic platforms, for example, to address the issue of some of the populations, like men who are reluctant to access HIV and TB services at health facilities. There are other things that we've seen have been developed in terms of the response. We've got now long-term acting antiretrovirals that we need to put into the strategy so that to guide the implementers with regards to these new developments. So there are lots of radical changes that we will see in this new NSP, some of which arose from the effects of COVID.
Dr. Rogerio Phiri, good to have your time. Thank you, sir.